Thank you very much, Dr. Schwarz. Before you have the opportunity to ask questions, I will give the floor to the two panelists, and afterwards we will all come back here and have our discussion. So first there will be Christa Stünzi talking about gender medicine from a legal perspective, as she's a lawyer, as I mentioned before. And then I will give the word to Professor Frank Luck, who will have a second statement.
Thank you very much. I tried to do it also in English, so it's easier. We have one language. One aspect which was really interesting to see is that the CEDAW Convention, so the law who looks at discrimination of women, has regarding health the same problem that actually medicine does, because it was the Article 12, which regards health issues, was one of the last one to include. It was longly discussed if it should be included anyway, and then it was mostly focused on really gender-specific, women-focused issues, so it regarded almost only the reproductive rights. It was only years after the convention that it was opened up, and the issue or the idea that gender and health have something to do with it, with each other, and we have to look at it a little bit broader than just only the reproductive part of it, was mentioned in the General Recommendation 24 of the UN Committee. But that's it. It's not really done yet. And when I prepared for tonight, I looked at the commentary I wrote together with Andreas Rieder 9 years ago, and we formulated a wish at the end of the commentary. And we wished that this aspect would be regarded more broadly from the legal perspective. And sadly, I have to say that we are still at the same point. So if I have to write the commentary again, I would end with the same wish. So yeah, that's from my perspective.
Thank you very much. I'm talking in German. Mein Statement ist, Gendermedizin ist mehr als Frauen und Männer. Es gibt mehr Geschlechter. Der zweite Punkt ist, wir dürfen nicht nur Gender und Sex sehen, sondern es ist wichtig, die Intersektionalität zu sehen. Wie leben die Menschen heute? Wie sind ihre Lebensbedingungen? Wie sind die Lebensumstände? Das ist eigentlich nicht neu. Wenn wir an Rudolf Virchow denken, die Medizin ist eine soziale Wissenschaft, dann gibt es dort eine lange Geschichte. Das bedeutet, Gender und Diversität ist zusammenzudenken. Und das Dritte ist, und wenn wir die Gesundheit in den Blick nehmen, dann stellt sich schon die Frage, was zu Gesundheit alles dazugehört. Und dazu gehören meines Erachtens auch die Care-Aufgaben. Also wer kümmert sich in unserer Gesellschaft eigentlich um andere Menschen und bilden die aktuellen Ökonomisierungstendenzen im Gesundheitswesen eigentlich die Realität von vielen Menschen ab? Welche Alternativen gäbe es zu diskutieren? Vielen Dank.
Thank you very much. Now, if you could join us as well for the discussion. Thank you very much for the statements of the panelists. We will now open the discussion. And as I mentioned before, please feel free to talk either in English or in German. Joel Schwarz understands very well German, I've seen before, but just either language is fine. So who would like to add a comment or a question on the presentation of Dr. Schwarz or the two panelists? Bishan?
Thank you very much.
Well, I can speak like this. Yeah, that's. Oh, I don't know whether for the Zoom is probably better if you use the machine.
So yes, this is a good point, and I agree with you that the medical community doesn't like regulations too much. Actually, in the USA, it's a law, and this law has also issues with it because it's maybe I will not go into this, but obliging all research to consider sex and gender, sometimes, as I said, it's not relevant. If you do cell research, depending on what you're looking at, it's not relevant to include this. And this now is a bit of an issue in the United States. But what we try to do is not to change the law, but to add a requirement at the SNF. So to us, it's a bit, if we manage to reach this, then it means all researchers, as I showed in the European example, would have to consider the question. It's not a law, but it's, at least it's mentioned there. People have to think about it, and they will know that they are being evaluated for their overall project, but also for this point. And the way we went forward is, so in Switzerland, we have, it's interesting, we have a Swiss Gender Health Network. It used to be funded by the BAG, by the Federal Office of Public Health, and it used to be on gender and health. And then, but that would be another topic. It became the theme became gender and diversity, and then it became diversity. And through this process, gender got lost, but that would be another point that we can discuss later. But anyway, we still have this informal Swiss Gender Health Network. And I think it was last year we went through the network and we gathered signature, and we sent a letter with signatures from different actors from the medical community and public health community, where we asked the SNF to consider including this in the requirements to access public funds for research. And the answer from the SNF was, yes, this is needed. We acknowledge it's needed, but it's very political. That's the answer we got. So we said, okay, fine. So we'll go through the political channel. And that's how we ended up going through this Frauensession, and also meeting with some of the parliamentary and try to go this way. And actually, last week, I had the chance to meet Alain Berset at another conference, and I went and asked him, what should we do now? We try the SNF. They said it's political. The political level say they don't want to regulate this, which I still have to go and look into the debate. So we're just trying by different channels to get this through. But I would agree that probably law is not the best way. And the SNF, and that was the answer from Berset actually, that the SNF is capable of adding this clause into their mechanism to access funds. So we will go back to the SNF, which is not a juridical measure.
I would like to add something to that, because I think politics and law has very much in common, because politics makes law. And I think something we sometimes forget is that in politics and also in law, we don't have to regulate every little detail, but we have to think about the broad issues, in which direction we want to go, and what is like the general principle we agree on. And in this case, it would help to have this general understanding and maybe frame it into a law, so everybody knows that's the direction we want to go to, and then have the self-regulation within the medicine community.
Also ich würde gerne Joel Schwarz unterstützen, nochmal anknüpfen. Wir waren in der Schweiz schon mal weiter. Also es gab eine Gender Health Unit beim Bundesamt für Gesundheit bis ungefähr 2010. Und dann, du hast die Geschichte erzählt, wie es gegangen ist. Und das Gender ist wie verschwunden sozusagen. Jetzt sind wir dabei, wieder Gender zurückzubringen. Wir waren im deutschsprachigen Raum nach Österreich, diejenigen, die 2006 einen Gender-Gesundheitsbericht gehabt haben, 2008 einen Fokusbericht Gender und Gesundheit haben. Und seitdem gibt es keinen genderspezifischen Gesundheitsreport mehr in der Schweiz. Und drumherum, die Länder haben aufgeholt und haben spezifische Reports veranlasst. Und der Punkt ist, wichtig erscheint mir, Gender ist keine Frage eines politischen Standpunktes, sondern es geht darum, Gender als Teil der Wissenschaft zu verstehen, dass es ein Qualitätsmerkmal ist, so wie es Joel Schwarz gezeigt hat. Es ist wichtig zu berücksichtigen, aber nicht in allem. Dann nehmen wir Stellung dazu. Aber es ist eine Chance, die Lebensumstände von Menschen differenzierter, sei es auf biologischer Ebene oder gesellschaftlich-kultureller Expertise, zu erforschen. Und ich möchte ein Slide von Joel Schwarz nochmal aufgreifen. Das war dieser Punkt, wo die Menschen in der Schweiz dran versterben. Und wir sehen bei den Männern zwischen 15 und 44 Jahren, dass es Gewalteinwirkungen und Unfälle sind. Das muss uns doch aufrufen, sich zu überlegen, wieso spielt das so eine große Rolle, wenn es nicht biologische Faktoren sind. Also Gendermedizin und gerade zusammen mit den politischen Akteuren als eine Chance für die gesamte Gesellschaft zu verstehen.
Thank you. There's a question over there. Maybe you can hand over the microphone. Thank you.
Thank you very much for the talk. It was very interesting. I would like to ask you about the pharmacological data that you showed, where you showed that pharmacological tests or in drug testing, it was mostly carried out on male organisms, so mice or people. You also mentioned about how the female hormone cycle is very complicated. And so do you think that the reason for this is that the hormone cycle could affect the efficacy of the drug, at least in like early drug testing? So do you think this is more like a practical limitation, or do you think this is really a like targeted ignorance of females in these trials? Thank you.
Thank you for the question. I think it's a bit of both. There's a whole history behind why when women were included and not included in research. So from this androcentric paradigm, they were not included. Then with the second wave movement, they were included in research, and that was in the 60s. And it's in the 60s that one drug was tested in men and women. What's the name of it? And this drug that was administered for women who had drowsiness, it actually caused many malformations in their No. Okay, how do you call it? Okay, I know it anyway. So it provoked a lot of malformations in babies, and that's when the drug had to be withdrawn from the market, and they realized that many other drugs were having, and this is the same we're still saying, they were having side effects because they had not been tested in pregnant women. So this also has to do with the difference in cycles, but also that women may be carrying a pregnancy, and you would need to test for women in pregnancy. So then the law became that you couldn't approve a drug unless it had been tested also in pregnant women, or you had to put in the label that the drug was suitable for pregnant women. And that's when women started being excluded again from clinical trials because it was too complicated and dangerous because of this. But anyway, yes, there are hormonal differences in women, and it means that you have to take this into account when you do your research, but you also have hormonal variations in men. They're just not the same, the time lapse, but you have these daily also differences that you would need to take into account, and often it's not the case. So it's not really that it's more complicated. You do add a level of complication if you have two groups that are maybe different in reaction to a drug, but that's the way the world is. You have variety, you have diversity in the world, and you need to take it into account in your research. So it's a bit of both, and it's financial reasons also that if you include women and men, or female and mice and male mice, then it doesn't mean you have to double your sample, but you have to have a larger sample, and it costs more money. So it's also the financial question.
Yeah, thank you very much for your talk. Very interesting talk.
I was just wondering, I mean, since 2006, you said that there was a report about gender medicine and how gender affects how medicine works. So it's obviously not something new. So I was just wondering whether there is some kind of best practice being practiced by the big pharma companies, for example, so that they are kind of have this best practice that they test their medicines on women as well as on men, or is there nothing?
There is loads of documentation and guidelines because in the European Union, when they included this, you're right, in 2006, the reaction of researchers were, we don't know how to answer this question because we don't understand the question. We don't understand what you mean by gender. We don't understand how is it different from sex. So many documents have been developed for researchers to explain and to guide them into understanding what is sex and why do we differentiate it from gender and how you could measure gender and how it needs to be included. So, and actually, I didn't think about putting this, but there is a lot of material on the site of the European Commission, the ERC, European Research Committee. You have a lot of documentation on what is sex specific analysis, what is gender specific analysis. So the European Union has a lot of documentation. The Canadian Institutes for Health Research has a lot of documentation, videos explaining what it means to be sex specific in cell research, in animal research, in human research. Stanford University has a website, it's called Gendered Innovations, and it really shows different case studies in medicine, but also in engineering, in biology, and in mathematics, I think. And in biology, I said already, that show also different why it's important to include gender. There's this example that maybe you have heard of in the way that you do road security tests with I don't remember how they call it, but seat belts. The way that seat belts have been manufactured, they are more best tailored for men as they are for women. So it's also about all this engineering stuff. So there are many sources of documentation for researchers. What has been developed also are some guidelines for when you publish papers for reviewers of scientific articles, so that they know how to look for these aspects in journal. I don't know if you want to add, but loads of documentation. So that's not an excuse for researchers to say they don't know. Pharma companies, it's a question I've had before, and I don't know pharma companies. And some of the research, so the data that we see that where men or women are not being included, or we don't know about the samples, they are coming from pharmaceutical industries as well. And they are mixed with research done with public fund. But I've never actually looked whether in pharmaceutical industries they're doing better than researchers using public funds. It's a good question. If you want to look into this, that would be wonderful. I'll brief you.
Are there any other questions? Well, there's still a lot of research to be done, as you've seen.
So thank you for your presentation. Just a couple of years ago, we implemented a pediatric test concept in Swiss law. So do you think a similar concept, like a sex and gender concept, could be implemented in Swiss law and would improve the situation? And what does it take to being accepted in politics and in the law?
I start with the end of the question. What does it need to be accepted? I think a lot of work and a lot of information, and especially a lot of the work you're doing, like informing the ones who are doing the law and the reason why it's important to have such laws. Because I think a a lot of politicians are not yet aware why it's that important, because they don't know the facts and the research which is done. We saw that in the parliament in Zurich, because we had the discussion about gender and health, and we pushed for more research and more development at the university. And now we have actually in Zurich at the university professorship, which is installed through this focus we had in the parliament. So you need to inform people and have the discussion why it's important, but that's a really time-consuming effort, and we need a lot of people to help us to do this.
Do you think that Switzerland is too small to implement such a similar sex and gender concept, so we just had to go to the European level?
No.
What is your way?
I mean, it was like that with the pediatric test concept. So we had the autonomen Nachvollzug.
I think the problem is not that we're too small. I think the problem is that we have a system where we always need a compromise. And that takes just much longer than if you just need a majority of one political side. I think that's probably the reason why. But that's not only in this topic, that's like everywhere in politics.
And maybe what I can add, the name of the drug is thalidomide. Thank you, Manfred. Even in medicine and health, we have these guidelines, European guidelines, 2006, and we still haven't moved in Switzerland. So it's still difficult to align, even if we have the comparison with the European Union. What I would say, we do this work in Lausanne, and at the moment we have we have a bit of power because there is an ongoing third feminist wave. There is the 14 Juin, there is the Me Too movement, and we have a bit more space to be loud. But still, when you talk about gender in medicine, and it's probably the same in law and in other faculty, it's still difficult to bring forward that gender is a scientific discipline. Gender studies have been established in social sciences since the 80s, but bringing this perspective in at least for where I work in the medical faculty, it's still difficult because it's considered as too much of a political topic and too close to people movements, feminist movements. And it's really difficult to convince and to bring my colleagues to understand that, and it's a bit what I wanted to show with the androcentric paradigm, that all the knowledge production that has been done, and this has been demonstrated in the social sciences since the 90s, that all scientific production is always situated in historically and socially. Biology and medicine were the ones who established that women were inferior to men. And it was the argument that we used during votation because they measured brains, they measured different things, and that's how they established a dominance. There was a discourse that women were naturally inferior. It was the same with Black people. It's biology and medicine who also help establishing these things. And so all the knowledge, and they were doing this thinking they were doing good science by showing these differences. So it's difficult to pass on the idea that all the knowledge produced is always socio-historically situated, and that having a gender lens is just improving the way we practice and we produce knowledge and not giving it a political dimension. But that's a big debate.
Thank you.
And I don't know if it's the same in law. That's my question back to you. Would you have the impression that gender has issues entering the discipline of law because it has this political dimension, perception?
Just as a general answer. Yeah.
Your boss is in the room.
Yeah, I agree. I mean, we have in law still the problem that we look at women's rights or gender issues always from a very specific lens, and mostly it's done by women. And it's also, I mean, when I worked on women's rights, there was always the talk like, you really want to go in this topic, there's like no way go further in this. It's just like, it's this small area where you're in, and I said it's like basic principle. We have to look at it, we have to talk about it, but it's still on the side corner. So we have to do a lot of talk also within the law community. And I think it has also a lot to do with representation. I mean, you mentioned the third wave of feminists. I think representation matters. It matters in disciplines like law, it matters in politics, it matters in medicine. The more diverse the people are who talk about issues, the more diverse are the ideas and also the lenses who look at something. So I think representation is one of the key elements to change any topic, especially the gender topic, because the more diverse the teams are who look at an issue, the better represented are all the genders. So all the questions asked are asked or have to be.
Ich finde, die Gendermedizin ist auch insofern eine Herausforderung, weil wir Situationen sehen, wo zu wenig aus der Perspektive von Frauen Gesundheitsfragen thematisiert werden oder wir sie in Studien zu Herzrhythmusmedikamenten unterrepräsentiert sehen. Also wir brauchen eine Perspektive, die im Fokus hat Frauen, auch wenn sie keine homogene Gruppe haben, und gleichzeitig reicht das aber nicht aus. Also die Unterscheidung zwischen Männern und Frauen, weil wenn wir zum Beispiel LGBTQ die Menschen sehen, dann sehen wir, dass ihre Gesundheitsstatus in Deutschland und in der Schweiz zu Gruppen wie Männern und Frauen noch mal schlechter ist. Sei es die psychische Gesundheit oder die Gesundheitsversorgung. Das heißt, wir brauchen eine Repräsentativität von Menschen, dass sie das einfordern, aber sie gehören teilweise zu den marginalisierten Gruppen. Also braucht es Leute aus der Gesundheitsversorgung, die eine Art Advokatin sind dieser Menschen, und es braucht Politikerinnen, die sagen, da sollten wir einfach genauer hinschauen. Das Ganze geht aber nicht ohne finanzielle Ressourcen wirklich. Und es geht auch nicht, wie Joelle Schwarz gesagt hat, ohne dass es Teil der Ausbildung ist von den Medizinalberufen. Weil wenn es nicht gelehrt wird, kann es nicht gelernt werden und dann kann es auch nicht erforscht werden. Das ist wie eine Kausalität, die sich eigentlich ergibt. Und dieses, was mir noch wichtig scheint, ist, bestimmte Gruppen auch nicht gegeneinander auszuspielen, sondern wir müssen mehrfach hinschauen. Menschen, die behindert sind, Menschen, die LGBTQ sind, und nicht, weil sie eine Sondergruppe sind, sondern weil sie Teil dieser Gesellschaft einfach sind. Das ist wie ein Auftrag, denke ich mir. Weil das Problem ist, in der Gesundheitsversorgung begegnen wir ja diesen Menschen mit ihren Anliegen. Und deshalb ist es schon Realität heute. Und die Frage ist, wie wollen wir zukünftig zusammenleben? Welche Rolle kann auch da das Recht spielen? Was bedeutet Patientinnenrechte haben, wenn ich nicht nur Mann und Frau bin, vielleicht mich non-binär verstehe? Ja.
Thank you. Are there any other questions? Someone is watching the online discussion. No, there's nothing. Thank you. Bishan? Yeah, of course. As much as you want.
Yes, I think your approach to increase the knowledge and the awareness about the role of gender in medicine is very, very important. And I also would like to support something that Professor Luck said. I think what you showed, your data showed that not analyzing pharmaceutical research data under gender aspects is simply bad science. It's not good science. So, for example, I think ethic committees should not approve such a research proposal. And but the knowledge has to come to the people who are inside of these ethics committees, and I hope it will be so. And also maybe from a law point of view, from the medical law point of view, I was wondering if, well, maybe a medical practitioner not recognizing a disease because of a gender bias, and because he does not know about differences between men and women and these diseases, may even be medical malpractice and be liable under civil or even criminal law. So we have to think about to address these issues, and also to communicate to the medical community that there is a duty to educate in these issues of gender medicine, as there is now recognized there is a duty to have an education in palliative medicine, for example. It was also a new field. Or another example, not recognizing, because I just dealt with this issue, not recognizing skin diseases in patients who are people of color, because they never looked at this. It could be a form of medical malpractice.
But do you see that there is a entry door through this channel?
Yes, but of course it's only at the beginning, and well, I think this is a good thing about this lecture you gave us. So we start communicating and discussing these things, and yeah, putting it into our medical law lectures, for example, and address these things there. So we're just starting. Too late.
We did. I'm not sure. We did think about whether the FMH, which is the degree that doctors receive, whether we could work with them to see if this could be a requirement, that to get their title, they must have followed in their studies or through continuous education something about gender medicine. And if I remember well, this has gone through one of the motion or petition that went to the parliament, but I'm not sure now. And I think that, so because it's feminist third wave, there are many different motions, petitions that have been submitted at the parliament, and they have all been grouped under one petition. It's the one by Fellman-Yriel, and it's now the mandate is with the BAG, who has outsourced the mandate to a group to do a study on what are the needs with regards to gender medicine in Switzerland. So they have to sort of give the image of what are the needs today. And so I act as an expert with the group who have this mandate. And it's a good idea. I should go back and see if we did think about mentioning some of these law aspects that could be suggested in the report. So thank you for that point.
Just to follow on from that, I haven't ever sat on an ethics committee, but my interactions with them is they will say no to something if there's something that's really unethical in the study. But that would be like, if the sample is too small to answer the question, they're going to do a child harm, they're taking too much blood, they're testing something on a population to which would not benefit from it. I think they would need a different frame of mind to say no to something if you're doing tests on men only, because tests on men only is a good thing compared to no tests, as long as there's another study somewhere else which is doing tests on women. To force them to do tests on men and women in the same study is slightly different to what they usually do. I'm not saying it's not possible or wrong, but they would have to change the way they think a little bit. Another thing which would be a pull for scientific research is for the journals to say we won't publish unless you've considered this point, because publishing is a big pull for everyone in research. So,
and from what I understand, and it's actually even stronger in animal research, there are now journals who have established strong guidelines on this. And I was talking to a veterinarian in Bern, no, in Zurich, who publishes, and he says it becomes more and more difficult to publish because there are, not for him, but journals are being a bit more, how do you say, exigeant? They're looking more at this now, but it's not the case in public health, in clinical research. And it's true that even if you could justify that you're doing your research only on women, and then you will say, at least we will get this evidence out. But what you often see in papers is the results, and that's especially if the sample is only men, it will not be specified, or it will be specified somewhere in the paper at the end in the limitation that this is only applicable to men. But you rarely find in titles saying, I don't know, this drug is efficacious on men only. And so, but it's true, because it means that you would have actually to go at all these levels of public funding, ethical commissions, journals who publish the papers to ensure that you not only have mixed samples, but you have good practices in analysis and reporting and discussing the results. Because another whole field is one of the danger of doing sex and gender specific research is you have a risk that we will go back to what we used to have, that is saying that women are naturally different to men, and not understanding that many of the differences are coming from gender aspects, social constructions, and establishing that you also see this research saying that women have different brains from men. There are still a lot of papers that are going into this direction, that hormones are driving behavior, and that they have now found the hormone that explains whatever behavior. So that's one of the risks also of inclusion, is that you may go back to this historical background of saying that women and men are naturally different, which is a problem.
That's a very interesting point, because when I read the report, the last report from the committee on the CEDAW from the UN for Switzerland, and also different other reports I looked through, I realized that they mostly talk about stereotypes, not only regarding health, but they always look at issues that we have a stereotype, a framing issue, that we have to look at these discussions very carefully, so we don't frame it in another stereotype way. So we don't look only at gender to find the reason why we have to treat the group differently. So we have to be very careful, and it was for me something new, because 9 years ago this was not that big of a topic. So this idea of we have to be very careful when we talk about specific groups. For example, rural women, or we talk about minors, that we don't go back to stereotyping them, even new stereotypes. So I think that's really a danger. So we have to be careful there.
Das würde ich unterstützen. Also es würde jetzt nicht darum gehen, neben der weiblichen Depression eine männliche Depression zu charakterisieren mit bestimmten Faktoren, sondern Gendermedizin eigentlich, wie ich auch jetzt die neue Bewegung hier in der Schweiz verstehe, ist eher kritisch zu neuen Kategorisierungen sein und selbstreflexiv nochmal zu überlegen. Also das würde bedeuten, alle Menschen können mal traurig sein, weil es ein kritisches Lebensereignis gibt. Und das kann sich durch ganz verschiedene Symptome zeigen. Das kann bei Männern, bei Frauen vorkommen und dafür eine gewisse Awareness einfach haben. Das wäre wichtig. Das heißt auch, auf der einen Seite sich einsetzen für Gendermedizin, bedeutet aber auch immer selbst zu schauen, wo tue ich nicht wieder eine Differenz befördern und dazu einer Naturalisierung eigentlich beitragen.
Thank you. Are there any other inputs or questions?
I would like to know whether you have a sense of like interstates, of how much the different regulatory authorities, they're sensitive on this topic when they approve new drugs or drugs for new indications. Is this something you know, like whether FDA is more sensitive when approving new drugs?
So FDA in the USA?
Yes.
They are under this law.
So this is something like they have already regulated to a full extent. So you would say if we would have the same regulation in Switzerland, it would fulfill the needs.
I don't know. I don't know. No, because it's a regulation in the USA, but we still see that many of the papers are coming out without a full inclusion, or so I don't think it's sufficient. And I would go back to saying it's through these different steps that we will manage to improve scientific practice.
So you would argue regulation is one step, probably an important one, but not sufficient in itself. I would like to, because there are a few minutes left, I would like to turn to some legal issues to the end, as we are in the Faculty of Law here. We have seen that there are many different legal issues concerned in this respect. It starts with doing research, but it goes until the relationship between the patient and the practitioner. So there are different fields of law involved. You even mentioned criminal law, civil liability, and so on. And we heard that you are still a bit disappointed since you wrote your commentary on the CEDAW. Not much has changed, at least under Article 12 of the convention. My question would be, did something change after Switzerland's ratification? I mean, in between the ratification and your commentary, did this have an impact on the situation in Switzerland at all?
In general, the ratification of the CEDAW had much of an impact. I mean, we have now, for example, a strategy on gender equality. We have different aspects. I would say the health issue is rather specific because we have done a lot of work regarding motherhood, right to have time after birth, access to care during pregnancy, during birth and after pregnancy, accessibility of all this. So I think there's, regarding the special reproductive part of Article 12, much was done. But regarding the general aspect of gender and health, it's still the same problem. But I think I would argue that's not only a Swiss problem, that's probably a global problem, because if you look at the framework from the UN, they still struggle with this idea of how to frame it without stereotyping it. That was my takeaway when I read the last comments I saw.
Does anyone want to comment on that or to add something?
Nicht im Moment, nein, denke ich. Ich meine, ich finde, ich weiß nicht, wie es Ihnen geht, aber wir springen ja auf der einen Seite, wir hören von den USA, wie es in der Europäischen Union ist, dann sagen Sie, es ist aber ein Global Issues sozusagen. Und was bedeutet das denn jetzt für eigentlich? Also wo dürfen wir auf der Ebene der Nationalstaaten agieren? Was ist wichtig? Und wo geht es aber nur international? Und ich habe den Eindruck, und da würde mich auch nochmal Ihre Perspektive zu interessieren, es geht bei der Anzahl der Probleme doch nicht ohne internationale Zusammenarbeit. Und eigentlich geht es nicht, dass die Schweiz etwas von der EU übernimmt oder die EU von der Schweiz übernimmt, dass wir neue Formen der Zusammenarbeit finden, weil wir es nur gemeinsam lösen können einfach.
Also da bin ich ganz Ihrer Meinung. Deshalb habe ich auch Völkerrecht und Menschenrechte zu meinem Hauptbereich gemacht. Oh, I go back to English, sorry. I would say, and that's in international public law always the problem, that you have on one hand you have the UN bodies which try to regulate something on a global issues to find like this compromise on a very much higher standard, and that's today much more difficult because there are more countries who have different issues. We drift apart in some ways. It's hugely more politicized than it was, for example, in the 60s. On the other hand, we have the national level where 1 or 2 states can actually go in one direction and push the whole community in one direction. So it is interlinked. It's not one or the other. So we shouldn't say only the UN can solve it, but we have to push in Switzerland and also push at the UN.
So there's time for one last question, if there's any. No comments on Zoom? Okay. So I would like to ask one last question, although it's a different topic. We could talk the whole evening probably also about that. Is one reason for what you found in your studies and your colleagues found in their studies that women are underrepresented in academia, not in our field? I think we have a higher level, more women compared to medical science or drug science. Do you think that's a reason too, that there's not much sensitivity concerning gender-related issues?
That's a very difficult question. In the medical field, since the 1990s, I think, there are more women physicians than men. So we really see that we have about 70% of the medical students are women. But then indeed, so we have more women as healthcare providers, but what we see is after their medical doctorate in higher positions in the hierarchy, that's where they disappear, and bosses remain mostly men. And people who apply for funds and do research and supervise research are still mostly men because of this phenomenon that we lose women when they try to go up the hierarchy. So this hasn't changed. And whether this will change because in the long run, at last, women will get these positions, hopefully. It's a good question whether it will change. Women tend to be more sensitized to these issues because of everyday life, being exposed to sexism, sexual harassment, or gender aspects. Women tend to be more sensitized, but also, I don't know how to say this. At the moment, in the hierarchy, in medicine is a very hierarchical domain. It's really the hospital. When I first entered the hospital, working in a hospital setting, I thought it was awful because it's the army. I haven't done the army, but it's really, you have to respect the hierarchy. And it means that as a woman, if you go up the hierarchy, you have to play the game. You have to play the game of being rough, of being putting yourself before everyone. So at the moment, they're not always our best allies, the women who are in higher positions. I hate to say this, but they are not our best allies because they had to struggle to get there. And they're probably dealing with enough other things to have time to think about these aspects. I don't know where I'm going with this, but so that's one part of the answer. The other part is what I teach to medical students. I have a course where I teach on reflexive practice. So we use clinical cases that they see during the week when they do their internship. And then we discuss how they manage patients, and we discuss about if we always ask the question when you explain this medical case, if it wasn't a man, but if it had been a woman, would you have done the same thing? Would you have asked the same question, taking patient history? Would you have done the same tests? Would you have thought of the same diagnosis? And that's a way of identifying these gender bias that they have in practice that are really implicit. They're not aware of having these biases. And what I find is that women have as many biases as men because we're all coming from the same societies where the same stereotypes, same representations. So women tend to have the same biases. The only thing that is easier with women is that they're quicker at recognizing that they do have stereotypes and where they come from and how you can work on them. And they're a bit more comfortable, not comfortable identifying that they have stereotypes and biases, but it's easier for them to enter this reflexive practice of thinking, yes, I may have biases and I know where they're coming from. So that's another part of the answer. I would like to be hopeful. Yes, things will change, but I don't know.
Ebenso ist eine neue Generation von Männern am Heranwachsen. Also es gibt nicht mehr die Männer mit dem traditionellen Männlichkeitsverständnis oder Verständnis von toxischer Männlichkeit nur und nicht als Gegenrede, sondern zur Ergänzung, auch davon ausgehen, dass Männer mit einem anderen Verständnis von Vereinbarkeit von Beruf und Familie auch im Medizinalsystem andere Karrierewege brauchen. Also warum können Führungspersonen oder sich Stellen auch nicht teilen oder Aufgaben sich teilen, so dass verschiedene Entwürfe möglich sind eigentlich. Und was ich in Bezug auf die Männer gerne sagen möchte, die Beschäftigung mit sich als Geschlecht ist schon häufig, wird verstanden als Infragestellung. Also es braucht neben den Role Models bei den Frauen, braucht es auch männliche Role Models, dass sie sehen können, es gibt auch andere Wege durch die Medizin.
Thank you. I think time is running out. Yes, it's 7:45. Thank you very much for coming to Basel and joining your ideas and thoughts with us, or sharing your ideas and thoughts with us. It was very interesting. Thank you to the audience. Vielen Dank für alle Ihre Beiträge und Voten, die die Diskussion sehr bereichert haben. We will now finish this session. There's one lecture left in this lecture series. It takes place in 2 weeks, I guess, and it's on crop science, so another issue under the label of the life sciences, and I hope everyone will join then as well. Thank you very much and have a safe trip home. Thank you.